there are things you can do to reduce the risk of cancer. For instance, you can avoid to smoke and you can avoid lung cancer, but at the same time, there are things you can do to detect cancer earlier. In this case, at Humanitas University and in our hospital, we set in 2022 a new screening for early detection of prostate cancer in a specific subset of subjects, not patients. And I mean all the people with a healthy man with a variance in DNA repair genes. I mean BRCA1 and BRCA2. They are very famous for breast cancer in women. We began the screening considering a physical assessment of all those subjects, and then we apply a new test, a new PSA, which is a Prostate Health Index, to investigate the risk of having cancer. In positive subjects with a high PHI, we used to perform MRI, and then if there is a suspect, an MRI, we apply and we perform a prostate biopsy. We need to start from the results. They are surprising because in a 2 years follow-up, we didn't find any prostate cancer. The reason why, maybe because we didn't find any prostate cancer, is based on the mean age, because our population, which is about 150 men with variants, pathological variants, the mean age of those population is very low. They are 51 years old in a mean age. And the second reason why we didn't find any prostate cancer is because applying a PHI maybe we reduce the number of unnecessary MRI and we reduce the number of insignificant and negligible prostate cancer. But what is the new opportunity we would like to offer our patients is the opportunity to know what is the genetic profile of those patients, and in case of diagnosis of cancer, they can receive a specific personalized treatment. In this meeting at ASCO GU 2025, we heard a lot of communication. We realized a lot of clinical trials using a personalized approach, such as the study and the clinical trials using, for instance, the new PARP inhibitor, specific PARP inhibitors such as PARP1 inhibitors. So it's only the first step in the global evaluation of a patient.